Welcome to Surviving Alzheimer's: Clarity, Courage, and Care. I'm your host, Terry Youngdale, and today we're talking about something that can feel really big when you're facing it for the first time. It's the first infusion day. What actually happens when you show up for your Leqembi Kisunla treatment? I'm going to walk you through it the way I wish somebody had walked through the whole process with me. Because here's the thing, it's the unknown. That's usually scarier than the thing itself, no matter what the thing itself is. It's the unknown. So I'm going to take you back about 5 years when mom had just been accepted into the clinical trial for a medication called BAN 2401. Eventually, BAN 2401 became known as Leqembi. We were thrilled, we were terrified, and hopeful all at once. And then the first infusion day came. Dad was mom's original study partner, and it wasn't until after he passed away that I took his place. Every second Monday, we would drive down to Kirwan Medical Center's Dallas Presby location. Mom hates busy freeways, so the whole drive down there, she would sit and pretend to read a magazine. But once we got there and parked the car, Mom was calm. She was remarkably calm. COVID was in full bloom, so as we entered the Jackson building, there was always someone there to check us in. They would take our temperature, make sure that we had the appropriate mask, and that we used enough Purell to kill all the potential bugs we were bringing in. We would then continue down the walkway, down to the Kirwan office. I was the one that was asking 1,000 questions. How long would we be there? What if something went wrong? What if it hurt? Would she feel it working? Those are the things that were spinning through my head. As we got there was always a nurse that greeted us as we entered the lobby. She was also super patient, somebody who could help me. I know that she could see the anxiety on my face. She would usher us down the treatment, into the treatment room, down the hallway into the treatment room. And our coordinator, who at that time was Sarah, would come in to greet us. She always assured me that most people feel nothing, and that was a very good thing. Julius was always mom's nurse. She was always very kind. Every time we got there, someone would check to see if mom wanted some coffee and quickly bring her favorite black coffee. Then we'd have just a few moments to catch up to see how everybody's family was doing. Over the years, we had a handful of coordinators working with mom. With the coordinators, with the people that were there, we built friendships. We developed relationships with them. We celebrated holidays, birthdays. We enjoyed watching Jenna become a grandma. We watched Julius's family transition from middle school to high school. Even Dr. Kirwan evolved from being an engaged lady to a bride and then to a newlywed. But there was no guide. There's no video to tell us what to expect. And I don't say that to poo on Kirwan Medical Center. What doctor do you have that offers a guide as to what patients should expect? But today I'm going to walk you through the infusion day process so you'll know what to expect and hopefully reduce any potential anxiety that you may have. So this is it. This is a clear step-by-step walkthrough of what happens on infusion day. So there's no mystery, no drama, just the steady cadence of what to expect, beat by beat. Because once you know the rhythm, it becomes manageable and eventually will become routine. So let's start by talking about what you do the day before. There's not a lot that you have to do, but there are a few small things that can be done that make a big difference. The first thing that you can do to make the biggest difference is to hydrate. Drink water throughout the day. Well-hydrated veins make the best IV start. It makes it much easier, trust me on this one. Second, if you can sleep, if you can nap and go to bed early the night before, a well-rested body handles experiences better. If you can't sleep because your mind is racing, that's okay too. It's the first day, and you're not going to be alone on that. As you proceed down through the process, you'll be able to sleep better and better on those nights. Third, the thing that I'm going to encourage you to do is pack an infusion bag. And here's what goes in it. Always have your photo ID and insurance card for the infusion center. If you're working with a research center, you won't need that past the first day. But if a standard infusion center, make sure you've got that. Pack a water bottle and a light snack, like granola bars, maybe some crackers or fruit, whatever feels good and normal to you, but try to keep it really low sugar. Sugar makes people a little jumpy, sometimes a little jittery, and that could make it hard for you to sit still. Bring a light jacket or something cozy. Clinics always run cold. Bring some lip balm because the air is usually very dry. You could bring a set of headphones, your phone charger, a book, maybe schedule or reserve a podcast, something to pass the time. Always bring your anti-amyloid infusion treatment journal, now available on Amazon, and any medications or symptom notes that you might want to mention to the nurse. Fourth, confirm your logistics. What time is the appointment? Where do you park? Who's driving? Does your care partner want to take anything with them beforehand? Do you need Tylenol? Do you need Benadryl? Some clinics recommend it, but most don't, but follow their guidance. Fifth, and this one matters, bring your care partner. This is a second set of eyes, a second set of ears, someone who will help you feel safe and be seen, someone who will advocate for you if that's needed. So at this point, you're ready to go, and let's walk through the day itself. First, you'll check in at the front desk. They'll verify your identity. They'll check your insurance, all the usual stuff, just like any other doctor's appointment. Then they'll take you back. Oftentimes, it's a comfortable infusion chair or a private bay. I remember Mark, who's one of the families that I work with, he told his wife on the first day, I thought it'd feel like just a number, but they knew our names. And for him, that small little thing was a big deal. It made him feel seen, and for him, that really mattered. Once you get settled, a nurse is going to check your blood pressure, your heart rate, your temperature. They're going to check your oxygen level. They'll also ask if anything has come up since your last visit. They're going to want to talk any new medications. And don't forget your over-the-counter medications. They're going to want to know if you had any headaches, any dizziness, confusion, vision changes, if you had any nausea or diarrhea. Those are things that they're going to ask you about and need to talk about. If anything's concerning, they're going to pause. They're going to loop in your provider because safety always comes first. Depending on where you are in your treatment, there might be a few additional steps. MRI milestones happen at specific dosages, so if they need to screen anything, they're going to review that with you. What they're looking for is a side effect called ARIA. This is something that they're going to monitor very carefully. Sometimes they're going to do labs. Sometimes there will be consent forms because the protocols change. This is a new treatment, and as they get more and more information, sometimes they'll need to review those additional protocols with you. Sometimes they're going to need to stop and educate you with new information or findings. They're going to walk with you on what to expect, when to call, and how to monitor things at home. All of this is designed to keep you safe. That's the whole point. So this is the point where the hydration from yesterday begins to pay off. The nurse is going to place a small IV in your arm or hand. Most people use a peripheral IV. So you're going to see a bag like this. And I'll open it up and show you the equipment that they're going to use. Small and simple. They're going to attach the needle to this end. This is the part that will go into your arm or your wrist. I'm sorry, not your wrist, or your hand. Lots of tubing. And then there's a little piece here that helps them determine how slow or how quickly the infusion goes into your body. And with this, they puncture into the IV bag. So easy equipment to work with. But if you're more comfortable, if you want to touch and experience, see more what each of these items are like, ask the infusion center to touch it. They can bring out a second set. These are very inexpensive, but if that's what it takes for you to feel more comfortable in this process, ask for it. They will be wearing gloves along the way, every step of the way. Warming your hands beforehand sometimes really helps. It can help you stay relaxed, but everything's going to go smoothly. Some clinics give Tylenol or Benadryl in advance to reduce the chance of an infusion reaction. It is not terribly uncommon for people to have a small reaction to the latex gloves or to the latex or silicone that are in the equipment that they use. So that's sometimes why you'll see the Benadryl being given. Others don't do anything at all, especially the first time. They want to see what you need and what reactions you might have. So keep that in mind. The clinic that mom worked with at Kerwin, they didn't use anything like that. There was no medication in advance, no Benadryl, no Tylenol was needed. So this is the point where we get to the main event. For Leqembi, it usually takes about an hour. For Kisunla, it takes 30 minutes to an hour. The nurse is the one who programs the pump. This is going to be for a slow, controlled rate, and then you just wait. You can read, you can nap, you can listen to music, you can chat, you can scroll on your phone. Whatever feels right, whatever feels most comfortable to you is what is going to work best. The staff will check on you periodically. They'll recheck your vitals partway through. They often come in and you'll see the nurse wiggle this little device that's going to help determine the flow also. Anytime you have any new sensations, you're going to want to mention it to your nurse. Feeling relaxed, maybe even a little chilly, that's why you brought the jacket. But those things are normal. They're going to want to hear about it. You might also notice a metallic taste in your mouth, but that's it. If you feel itchiness, any flushing, if your chest feels tight, if you feel dizzy, if you get a headache, or if you feel any nausea, tell your nurse immediately. Most mild reactions can be managed by slowing the rate of medication or giving you a little bit of medication to get through it. If you feel any nausea, ask for an emesis bag. They're really easy to work with. It opens up, and if you get sick, you just put this up to your mouth. It'll catch everything. And since you're not at home, you get to hand it off to the nurse when you're done. They will also be able to give you medication to help. Ondosterone is usually what you'll get. If they give you a tablet, these are so tiny, it's smaller than even a little piece of orzo. You'll take this with water. I would encourage you to ask for an ODT, which is an orally disintegrating tablet. If you ask for that, you can put it under your tongue. It dissolves immediately and goes straight into your blood system. This is much quicker than a tablet. If they don't have that and a tablet is your only option, you can put that under your tongue also. It doesn't taste good, and it'll dissolve not as quickly as the other, but it will dissolve and go into your bloodstream quicker. So depending on your level of nausea, you'll want to do that. If you do get sick to your stomach after you've taken the tablet by mouth, not under your tongue, you'll want to ask for another one because the first one's gone. Nina, who is another family member that I work with, told her son halfway through her infusion, I forgot I was even getting medication. And for them, that was super comforting. After the bag of fluids finishes, you'll stay for a short observation period. This is usually 15 to 60 minutes, depending on where you are in the treatment process. In the beginning, they'll observe you for longer than they will once you've been doing it for a while. Once you've been doing it for a while, it's just going to be 15 minutes. But they're watching for any delayed reactions. They'll recheck your vitals one more time. When the IV comes out, let me pull this little piece. This is the piece that has the needle in it. And if it's in your arm or in your hand, that will pull out. They'll put a piece of gauze on top of it and just hold that for a moment while she's putting everything to the side. Hold it for a moment, or if they put it in your arm, hold your arm up high. Hold that gauze on top of wherever the needle just came out, but hold it up over your head. So if any of the blood is leaking out of that vein, which a few drops will possibly come out, you'll want to make sure that you keep that injury up high so you'll have less bleeding or less bruising in the process. They use just a little bandage to wrap around the gauze. And so it just takes a moment for them to set the IV equipment aside and wrap you up. And then you'll be good to go after that. Most people, depending on the time of the day, we always went to lunch afterwards. And so depending on the time of day, maybe you're going to dinner. Some people enjoy a short walk afterwards, something that's normal and something that's grounding. So it becomes a part of your routine. One of the things, or some of the things that Mom and I learned along the way was to create your own rhythm. Some people enjoy stopping for coffee on the way. Some people make a playlist so they've got music to listen to. Some bring a favorite blanket, a quilt, or an Afghan. Afterward, like I mentioned, taking just a really quick walk is very nice. Nothing big, just around the parking lot or a nearby park. Getting some fresh air, having just a little bit of movement can help. If you have time, maybe balance some time or create some time so you can enjoy a quick nap once you get home. Jay, who is one of the sons that I worked with, said that they just treated the whole process and created a ritual with it. Coffee, playlist, infusion, and then a walk around the park. It just became, he called it their vibe. After you leave, and for the first 48 hours, there's a few things that I want you to keep in mind. Most people feel fine after an infusion, so that's totally normal and they go about their day. It's also common to feel pleasantly tired. And try to find a way to take it easy if that's the case. Gentle movement, more hydration, a protein-rich snack will usually help. Here's what I need you to know and hear very clearly. Call your clinic right away, even if it seems mild, if you notice any of the following symptoms. If you have a new or worsening headache, call the clinic. If you have any confusion or you just feel off, call the clinic. If you have any vision changes, blurred or double vision, call the clinic. If you have dizziness or you feel just a little off balance, call the clinic. If you have nausea, diarrhea, any vomiting, call the clinic. If you develop a fever, chills, a rash, or shortness of breath, call the clinic. The reason why is these can signal an infusion reaction or rarely early signs of ARIA. Quick reporting keeps you safe, so don't wait, don't wonder, just call. This is super important. If you experience weakness on one side of your body, or if you suddenly have trouble speaking, dial 911. Don't call the clinic. Don't call to talk to anybody else about it. Immediately dial 911. They will get you the right help. Tell them the medication that you've had. They will send an ambulance. They will get you to the hospital. And if you're having an ARIA episode or stroke, they need to know this, and they need to know it in an hour. So if you're the care partner listening to this right now, this is what I need you to know. Your role matters more than you possibly know. You are the observer, and you are going to be able to notice the small things. You're going to notice a new symptom, a shift in mood. Maybe if there's a question that needs to be asked, you're the one that can do that. And here's why this helps. You're able to track the patterns. You can use your anti-amyloid infusion treatment journal to write down the date and time of each infusion. How did it feel? How was the evening after? How was the week after? Patterns show up over time, and that information is gold for your medical team. Keep the journal, write down everything you can about the MRIs, the neurology visits, all the infusion days. It's all going to come really quick. And a journal can help you keep on the same page as the patient and as your treatment team. Bring comfortable items for yourself too. A favorite blanket. Stop at a cafe and get coffee for you too. Something small that says we're in this together. And here's the most important thing. Your presence, just you being there, is the medicine too. You're showing up, being there, asking questions, holding space. This matters. Last week, we talked about caregiver meditations, and this is a perfect opportunity for you to take advantage of those solutions. You'll find free meditations on my website and on my YouTube channel. They are designed specifically for people receiving this medication and for the people that are taking care of them. So there are some common questions that people ask, and I will share these with you. One of the big ones is always, do I need to fast before treatment? And the answer is usually no. There are occasions where you might need to, and if that's the case, they will tell you in advance. So don't worry about fasting unless you get special instructions to do so. Eat a normal light meal and hydrate unless the clinic tells you otherwise. Will I get pre-meds every time? Maybe, maybe not. It depends on you. Only if your clinic's protocol or your history suggests that you need them will you have to worry about any pre-meds. Most patients don't need them. Can this be done at home? And the quick answer is no. These medications are given in an infusion center where monitoring and emergency support are immediately available. Safety is the priority here. I know you've heard about auto-injectors coming soon, but those are for patients who are at least 18 treatments in. So you've got a ways to go before you get there. And that's only with Leqembi right now. How long will I be on the treatment? Leqembi is ongoing. So until you or your neurologist decide you're finished with the treatment, this might be something that you're on for many years. Mom's been on it for 5+ years. Kisunla is usually given in 18 doses. So that's 1 dose a month for 18 months. However, I'm hearing some physicians do pause it. If they notice that all of the plaque is gone, sometimes they'll pause that treatment and then have you start up again later. These treatments are so new that protocols are, and the development of those protocols are ongoing. One of the other questions that I see a lot is, do I have to feel something to know that it's working? And the answer is no, you don't. Many people feel nothing at all, and that's a really good thing. The medication is doing its job quietly in the background and protecting what matters. Infusion day is structured, it is monitored, and there's way less drama than most people ever imagine. With a little bit of preparation and a steady routine, treatment days become just a part of life. They become a calm, predictable part of your world. One way you're actively protecting memories and your independence. I won't lie to you, there are some hard days in this journey, days when the weight of it all feels very heavy, but infusion days are not one of them. For us, it was a chance for us to go in and see the friends that we had developed over the years. You'll find your rhythm, you'll build your rituals, you bring your person, and remember, you're not in this alone. If you want help mapping out your infusion routine, let me know. I can help you create a symptom checklist or figure out what to watch in between the infusion visits. That's what I do to help. You can go to my website at memorytreatmentadvisors.com, click on schedule, give me a call, and we'll schedule a call. Don't forget that I did create and published an anti-amyloid infusion treatment journal. That is a big mouthful, but that's what it's called. It is available on Amazon and it's on my website. You can get a hard copy or you can get a PDF version. And if you want to join us on our Alzheimer's treatment care circles on Zoom, I invite you to join us on Thursday night or Saturday afternoon. This is our space to just talk through exactly this kind of thing. Earlier today, I had a call with a lady and we just talked about her sister and what her sister was going through and what she could do to support her. So no matter what your questions are, I can help you walk through that. Next week on the podcast, we're going to talk about something that does not get enough airtime. But what do you do when you start to feel like you're losing yourself as you're in treatment or as you're caring for someone who is in treatment? We'll talk about how to find your footing again, how to remember who you are in the middle of all this. It's a conversation I needed years ago, and I think you'll enjoy going through that now too. Until then, take good care of yourself and each other. I'm Terry, and thank you for being here today.